Now for the next drug which we'll be discussing, that's the next gene therapy drug which we'll be discussing, is what is known as the Axicabtagene. So Axicabtagene ciloleucel, that's the full name of the drug. Now the brand name for this drug is what is known as the Yescarta. So the Axicabtagene ciloleucel is a CD19 directed autologous CAR T-cell therapy. It's approved for the treatment of what? B-cell lymphomas in general, okay, mostly the ones that have relapsed or refracted. So what's the drug class? Is an autologous cellular immunotherapy, that's a CAR T. It targets a CD9, which is what the protein or antigen expressed on B cells. Okay, so how does this drug work? The patient's T cells are brought out. You mix them with this drug. So what usually targets the CD19, right, is what will now activate the T cells. So just get the story. When you mix the person's T cell with this drug, it activates a lot of those T cells. So once T cells are activated, they make your immune system very strong because T cells are cytotoxic. So when you reinfuse those T cells back into the body of the patient, then they can now fight cancer cells better. Okay, so when you reinfuse them back, they recognize CD19 positive malignant B cells, and to induce the breakdown of those cells, or you say it induces cytotoxicity. So pharmacokinetics is just single infusion, and you see that to start working in about 1 to 2 weeks. Okay, it's mostly used in treating refractory large B-cell lymphomas, used in treating mediastinal large B-cell lymphomas, relapsed or refractory follicular lymphomas, and the rest of it. Okay, so adverse effect can cause cytokine release syndrome and can be toxic to your nerves, cause you to be confused, have some seizures, and also encephalopathies. Okay, so that's what we got for the Axicabtagene ciloleucel.